So tell me, which are good food and which are bad food for your teeth?
Like chips, pasta, and all. They are not good for teeth.
Even pasta.
Dental neglect is more painful, but if you take care of your dental health, nothing is painful. Your entire experience of dentistry will be fun, enjoying, and pleasurable.
लोग ज़्यादातर डेंटिस्ट के पास आने से बहुत डरते हैं. डॉक्टर रोहिडा, यू हैव वर्कड विद लॉट ऑफ सेलिब्रिटीज़ ऑल्सो. तो आपका कैसा एक्सपीरियंस रहा है उनके साथ?
I must say that they are very humble, they are grounded, and they are beautiful people from inside out. Challenging procedures आते हैं जब एक पेशेंट में बहुत सारे प्रॉब्लम्स हों.
एंड व्हाट इज़ डिजिटल स्माइल डिज़ाइनिंग? ये तो मैंने टर्म पहली बार सुना है.
People are becoming aware of their, smile and, the front teeth. They are aware about it.
ये बताइए, डेंटिस्ट्री ट्रीटमेंट इतनी एक्सपेंसिव क्यों होती है? अच्छी स्माइल हर कोई चाहता है, मगर अच्छे दांतों और स्माइल के लिए हमें एक स्पेशल डॉक्टर की ज़रूरत पड़ती है. आज हम मिलने वाले हैं एक ऐसी डॉक्टर से जिन्हें 15 साल से ज़्यादा का एक्सपीरियंस है एस्थेटिक डेंटिस्ट्री में. शी ऑल्सो स्पेशलाइजेस इन रूट कनाल एंड स्माइल डिज़ाइनिंग. She and her team of doctors at her clinic Trudentz are passionate about their work and treat their clients like family. She's also been nominated and awarded for Aesthetic Dentistry Practice and Digital Dental Practice at FAMDEN Awards 2024. Let's welcome Dr. Diya Rohida. Hello, Diya.
Hello, thank you so much, Ekta, for inviting me to this podcast.
Welcome. How are you doing today, Dr. Diya?
Yeah, very well.
Okay, हमें बताइए कि आपने कब सोचा कि आपको एक डेंटिस्ट बनना है?
So basically, since childhood मेरा मन था कि मैं डॉक्टर बनूं. और मेरा बहुत बड़ा इंस्पिरेशन मेरे एल्डर ब्रदर रहे हैं. वो डॉक्टर हैं और उनका खुद का प्राइवेट हॉस्पिटल है. सो वहीं से मुझे काफ़ी इंस्पिरेशन मिला. बट हाई स्कूल पे आते मुझे समहाउ मैंने काफ़ी इवैल्यूएट किया खुद को और रियलाइज़ किया कि मेरे अंदर एक क्रिएटिव और आर्टिस्टिक साइड है जो बचपन से ही आई वॉज इन टू आर्ट एंड म्यूज़िक. सो मेरे फ्रेंड्स के फ्रेंड्स थे, उनके जो भी डेंटिस्ट थे, जो भी मेरा एक्सपीरियंस रहा उनके साथ मैंने शैडो वर्क किया उनके साथ. एंड आई रियलाइज्ड दैट दिस इज़ द फील्ड दैट आई वांट टू चूज़. And so during high school I realized that dentistry will be my field, and I seriously enjoy my work because my creative side is brought into action through dentistry. So
Wow,
yeah.
amazing. लोग ज़्यादातर डेंटिस्ट के पास आने से बहुत डरते हैं. ऐसा क्यों होता है? आई एम श्योर आपको देख के तो कोई नहीं डरता होगा, बट आपको क्या लगता है ऐसे क्यों होता है?
सो अगर कोई डरता भी है तो आई मेक श्योर कि वो पहले कंफर्टेबल हो जाए क्लिनिक में, कि दैट्स हाउ वी शुड बिगिन. सो डेंटिस्ट से डर इसलिए लगता है क्योंकि फियर ऑफ अननोन होता है. सो जनरली पेशेंट्स जब क्लिनिक में आते हैं तो वो बहुत पेन में होते हैं. तो वो जो पेन का एक्सपीरियंस होता है वो और एग्रेवेट हो जाता है जब वो क्लिनिक के अंदर आते हैं. इतने सारा इक्विपमेंट्स, मटेरियल्स देखते हैं, इंजेक्शंस देखते हैं. सो और ज़्यादा बिल्डअप फेयर का होने की वजह से लोगों के अंदर ये एक है मन में कि डेंटल क्लिनिक पेन एक्सपीरियंस होगा वहाँ पे जाके. हाउएवर मेरा ये मानना है कि डेंटल क्लिनिक से डरने की बिल्कुल ज़रूरत नहीं है, क्योंकि अगर हम एक स्ट्रेस फ्री एनवायरनमेंट पेशेंट के लिए क्रिएट कर देते हैं तो आई मस्ट से दैट dental neglect is more painful, but if you take care of your dental health, nothing is painful. Your entire experience of dentistry will be fun, enjoying and pleasurable. So yes, as a dentist मेरा पहला काम है कि मेरे पेशेंट को मैं एक स्ट्रेस फ्री एनवायरनमेंट दूँ, उसे कंफर्टेबल करूँ, and then I carry forward explaining the entire procedure, and that's how everyone should practice. Yeah.
Amazing. We need more dentists like you actually. अच्छा बताइए कि किस तरह की कॉमन प्रॉब्लम्स आप देखती हैं लोगों में?
या सो कॉमन प्रॉब्लम्स जो रूटीन हमारे प्रॉब्लम्स रहते हैं पेन से रिलेटेड, अब पेन इन्फेक्टेड टूथ की वजह से भी हो सकता है या विजडम टूथ प्रॉब्लम एट्सेट्रा, बहुत प्रॉब्लम्स होते हैं, तो बेसिकली या पेशेंट विल टर्न अप कि उससे पेन है। देन गम ब्लीडिंग के इश्यूज़ बड़े कॉमन होते हैं पेशेंट में, या फिर ग्राइंडिंग के इश्यूज़ हैं, या उनका मिसिंग टूथ है। सो ये बड़े कॉमन बेसिक इश्यूज़ हैं जिस वजह से पेशेंट्स आते हैं। बट टुडेज टाइम्स हैव चेंज्ड एंड इन आवर क्लिनिक पेशेंट्स दे रियली कम फॉर improving the appearance of their smile. They say, ma'am, I need a smile makeover. So yeah, and I'm so happy and glad that more people are becoming aware of their smile, and the front teeth, they are aware about it, the problems, they are already aware about it, and they want to change their appearance. So yes, aesthetic dentistry has been booming in the recent times.
That's great.
Yeah.
Dr. Rohida, you have worked with lot of celebrities also. तो आपका कैसा एक्सपीरियंस रहा है उनके साथ?
काफ़ी अच्छा एक्सपीरियंस है, और जो भी ये सेलिब्रिटीज़ मेरे पास आते हैं, आई मस्ट से दैट दे आर वेरी हम्बल, दे आर ग्राउंडेड, and they are beautiful people from inside out. We do the routine procedures, and because they have to face the camera, so we have to take care of the smile also. So for me, I only advise treatment when it is really important. We don't unnecessarily advise treatment which can affect with the function of the teeth and the chewing pattern. So they are already so beautiful, they have a natural smile, so we make sure that with minimally invasive cosmetic procedures or simple treatments, we enhance their own natural smiles. And also because of this reason, I think they stick to us and they trust us completely.
That's really good. अच्छा, अब मुझे बताइए, let's go to the basics. Brushing important क्यों होती है?
ब्रशिंग इम्पॉर्टेंट क्यों होती है, मैं पहले आपको ये बताती हूँ। अगर आप ब्रश नहीं करेंगे तो क्या होगा?
ओके, ठीक है।
So, अगर आप ब्रश नहीं करेंगे तो बेसिकली आवर माउथ इज़ फुल ऑफ बैक्टीरियाज, एंड देर इज़ अ स्टिकी फिल्म जिसे हम प्लाक बोलते हैं, विच दिस फिल्म इज़ ऑफ बैक्टीरिया एंड इट स्टिक्स टू द टीथ. So what happens is when you eat food or when you consume something, so these bacteria, they multiply in the mouth. And once they multiply, if you leave it as it is and you do not do any kind of brushing, they will become hard. Okay. And within a few hours, they become hard because of the presence of minerals in the saliva. And once they become hard, it is very difficult to remove them with the brushing also. And then a byproduct called acid is released when the bacteria consumes the sugars that are present in the food, and this acid will start destroying your enamel, which is the strongest part of your tooth, which is the topmost covering, and will also lead to gum problems. Hence, brushing is very important and everybody should brush.
और कितने बार ब्रश करना चाहिए?
दिन में 2 बार ब्रश तो बेयर मिनिमम करना ही चाहिए.
ओके.
तो मॉर्निंग में उठने के बाद ब्रश करना है, एंड रात में सोने के पहले ब्रश करना है. Apart from that, you can choose to brush if you are having sticky, starchy food that sticks on the teeth. You can brush, and also you can rinse in between. If you are consuming any beverage or any food that has sugar in it.
Okay.
So it's not practical always to brush. You are in the office and you can't carry your brush. But at least having a habit of rinsing after the meal helps a lot.
हमें ब्रश ब्रेकफास्ट से पहले करना चाहिए या ब्रेकफास्ट के बाद?
हमें ब्रशिंग ब्रेकफास्ट के पहले करना चाहिए, बिकॉज ड्यूरिंग द नाइट टाइम जो भी हमारा प्लाक बिल्डअप हो जाता है वो इमीडिएटली उठने के बाद क्लीन हो जाना चाहिए. बिकॉज इमेजिन आपका पूरा प्लाक बिल्डअप है एंड दैट प्लाक इज अक्यूमुलेटेड विद बैक्टीरिया, एंड नाउ यू स्टार्ट ईटिंग फूड. सो food and bacteria, when it combines, it will start producing more acid in the mouth. Acidic mouth is not okay because it will lead to dental problems. So when you get up, brush your teeth, and then you can consume food, and maybe after that you can rinse your mouth, and gentle brushing may be advised after breakfast also if people want to.
Oh wow. But मैंने ये भी सुना था कि बहुत लोग बोलते हैं कि you should brush after having breakfast because you have good bacteria in your mouth.
Yeah, we can brush, after breakfast. Definitely, because again, throughout the day, for a long period of time, you'll be having that breakfast food in your mouth. So, yeah, we can do brushing, but please make sure when you brush, you use a gentle brush and gentle strokes while brushing. Because brushing too many times also in a day will lead to loss of dental enamel, which people don't realize. So
Correct.
if you remove the strongest part of the body, that is the topmost layer of the tooth, and you brush aggressively many times a day, so you lose your dental enamel in the long run. So hence, be very mindful of the brushing. You can brush after the breakfast, but please use gentle strokes.
Okay. ओके मैम, आई वांटेड टू नो, कॉस्मेटिक डेंटिस्ट्री अभी बहुत ज़्यादा बूम में है, जैसा आपने बताया कि ये क्यों है, मतलब लोग अपने लुक्स को लेके अभी बहुत ज़्यादा
Yes.
कॉन्शियस हो गए हैं, सोशल मीडिया या बहुत सारे प्रेशर्स हैं या बहुत सारा अवेयरनेस है. व्हाट इज़ द रीज़न अकॉर्डिंग टू यू?
Definitely awareness तो है, and people want to improve their appearance, and you know what, smile is very integral part of your personality. जब भी आपसे कोई पहली बार मिलता है और बहुत अच्छी pleasing smile अगर आपकी है, तो वो बहुत attractive trait माना जाता है. So yes, people are becoming aware and they come to us when their front teeth are not in a proper place or position. So बहुत कॉमन इश्यूज जो हम देखते हैं पेशेंट्स में, सबसे पहली चीज़ है डिसकलर्ड टीथ है, इनका कलर प्रॉपर नहीं है फ्रंट टूथ का. सेकंड, अगर आपके दांत चिप्ड हैं या डैमेज्ड है या प्रॉपरली पोजिशनड नहीं है माउथ में, अलाइनमेंट में प्रॉब्लम्स हैं दांतों में, या गैप्स हैं बिटवीन द टीथ. सो दीज आर वेरी कॉमन प्रॉब्लम्स वेयर पीपल कम टू अस एंड दे अवेल द फैसिलिटीज़ ऑफ कॉस्मेटिक डेंटिस्ट्री.
व्हाट इज स्माइल डिज़ाइनिंग एक्चुअली?
So, smile designing is a process where we evaluate the soft and the hard tissues of the mouth,
Okay.
yani gums, teeth, bone, and then we are bringing some changes to them so that it can improve the aesthetics of the face.
Oh,
So, smile designing is not just designing the teeth,
okay.
it is analyzing the face, looking at the smile of the patient, and then designing the teeth.
Oh wow.
Yeah.
एंड व्हाट इज डिजिटल स्माइल डिज़ाइनिंग? ये तो मैंने टर्म पहली बार सुना है.
या सो डिजिटल स्माइल डिज़ाइनिंग भी हम डिजिटल टूल्स टेक्नोलॉजी यूज़ करते हैं जिससे हम पेशेंट का स्माइल डिज़ाइन कर सकते हैं.
Okay.
एंड वी हैव, आई मस्ट से दैट वी आर वेरी प्राउड टू हैव आवर ओन प्रोप्राइटरी dental treatment simulation software called DTS Pro software, which
Okay.
is developed by Dr. Neeraj Rohida.
Oh.
And we are using that day in day out in our clinic so as to show the patient their smile even before starting the treatment. So I'll just tell you, you go through the steps of the digital smile design is, so when a patient walks in the clinic, patient आता है और उसे सबसे पहले हम फोटोग्राफी रूम में लेके जाते हैं, उनकी फोटोग्राफी होती है which is professional, and then once we do the photography, we analyze the face of the patient, the teeth and the smile, and use our DTS Pro 2D software and design the smile, and immediately within 2 minutes the software shows the corrected smile of the patient. You know, so that smile the patient visualizes, and post that we do the digital scans, intraoral scans, and after that we again make the changes in the tissues and hard tissues, and then the patient can visualize the smile in his own mouth even before starting the treatment with the printed models that are made with the 3D software of DTS Pro. So basically it's a real-time experience which our patient get.
Wow.
Even before we touch them, they can see their own smile in their mouth. So now what does it do is, we are seeing the end of the treatment at the beginning only.
Wow.
So that also helps in planning the treatment and executing the treatment well. The end is in the mind already, and it instills a lot of confidence in the patient.
Wow.
Because he's already seeing what he's about to get in his mouth. So yes, it's a boon in the field of cosmetic dentistry,
Yeah,
all
yeah.
the digital tools.
This is like real advanced dental
Yes.
treatment, right?
Yeah.
अमेजिंग। अच्छा, अभी बताइए, विनियर्स, क्राउन्स, लैमिनेट्स, ये सब स्माइल डिज़ाइनिंग में यूज़ करते हैं आप?
Yes. So veneers, crowns, and laminates are. I'll just tell you about the veneers. Veneers are nothing but very thin shell of porcelain, which we stick on the front surface only. It's very minimally invasive. Hardly some of the enamel is just replaced with these materials to bring a change in the shape, size, and to bring the change basically in the proportions of the teeth. So then we come to the crown part of it. So there are different materials which are aesthetic in crowns, but crowns are used when the damage of the teeth is much more, beyond which replacement has to be done by thicker material, and overall coverage is there in a crown. So if the extent of damage of the tooth is too much, then we prefer a crown in such cases. And laminates are, again, it's a little thinner than the veneer, where minimally you need to scrape off the enamel and then replace it with an aesthetic material. And these are basically ceramics that are used in dentistry, and we bond it. They basically work on bonding mechanism. We need enamel to work when we are working with veneers and laminates.
टीथ अलाइनर्स और ब्रेसेस, क्या ये इम्पॉर्टेंट हैं? आर दे ऑल्सो पार्ट ऑफ कॉस्मेटिक डेंटिस्ट्री?
So teeth aligners and braces are orthodontic treatments basically.
Okay.
But they correct the misalignment and the mispositioning of the teeth. So isliye they are a part of cosmetic dentistry, because definitely they improve the appearance of the teeth by proper positioning of the teeth. So coming to aligners and braces, aligners is a discrete way of positioning the teeth in a proper place. They are thermoplastic trays that are used on the teeth, and basically they are just invisible, So clear aligners, they use transparent thermoplastic material on the teeth, which are not visible at all. Generally, the trays are changed, over a period of 15 or 20 days, and the duration of the treatment may be a year or two. And for traditional braces, they are using brackets and arch wires or wires on the teeth, which are visible. And so the difference between the two is one is visible and the other is not visible at all. However, the comfort level, if you see with invisible braces, will be much more than the traditional braces. So yes, there are pros and cons in both, but yes, today people are aware about aligners and want to go for more in aligner treatment, clear aligners, because it's more comfortable. You can even remove, before eating the food, and but yes, it has to be 120 to 22 hours maximum time during the day, and there's no hesitation wearing it because it's just not visible at all.
Okay.
Yeah.
Okay, so I've heard a lot about lingual braces also.
Yes.
What is that? Is it some new form of braces?
So lingual braces has been there since a while.
Okay.
And lingual braces are hidden braces basically.
Okay.
They are traditional braces only, but they are installed at the back of your teeth. So because they are installed at the back of the teeth, they are not visible at all.
Okay. So मतलब जो normal braces दिखते हैं, ये वाले
ये back of
नहीं
the
दिखते
ये
हैं.
दिखते
Okay.
नहीं है,
They are
hidden
at the back. Okay.
Yeah. So if I talk about the cons of the lingual braces, I would say initially patient को थोड़ा difficulty होता है speech में, थोड़ा tongue movement में, and to get adjusted to lingual braces will take time, but the patient does get adjusted to it. The duration of the treatment may be a little longer than the traditional braces. That's the only thing. Otherwise, the end results will be the same as the traditional braces does.
Okay, tell me, does anyone have perfect teeth according to you?
Perfect teeth term is used more for marketing and advertising.
Okay.
So we as dentists, we focus more on giving our patient healthy, functional, and aesthetically pleasing smile that suits to his or her face.
Okay.
So perfect teeth is a term that I said it's rare. If for example, I'll just explain you. If we have a perfect set of teeth, white in color, good in proportions, and I just take it and put it on your face, do you think that it's going to suit your face? So it has to be, you have to be comfortable with
aligned
chewing.
your jawline
Correct.
and your face.
So you have to be
features.
comfortable with biting with them. Your face has to look good with it, and your smile also should look good with it. So yes, that's why I say we as dentists focus more on face and smile, and then we design the teeth accordingly. So it's
Okay.
unique to every patient.
People are doing treatment on even gums nowadays
Yes,
for
yes.
the appearance and
Correct.
the cosmetic reasons. So
Yes.
आपको क्या लगता है? Is it a good thing to do?
So there are people who have gummy smile. There is excess of gum tissue visible more than the teeth.
Okay.
So in those cases where they want to enhance their smile, तो वहाँ पे we have to do some gum contouring and reshaping procedures. Okay, and after doing those procedures, then we increase the proportions of the teeth. That definitely improves the appearance of the smile. And also there are people who face gum disease problems, and also there also we have to make sure that their gums and teeth, they are healthy before we go ahead with any kind of aesthetic procedure. We have procedures called crown lengthening also, where with the gum the bone is also removed, and then we increase the proportion of the teeth size, and then perform the veneer or the crown or whatever procedures cosmetic we are going ahead with. So yes, and it's very comfortable, painless procedures done with lasers or normal scalpel surgeries. So yes, it's now in very integral part of the cosmetic dentistry.
Yeah.
Yeah.
So आप बताइए कि बहुत ज़्यादा डिफ़िकल्ट प्रोसीजर कौन सा होता है डेंटिस्ट्री में?
सो चैलेंजिंग प्रोसीजर्स आते हैं जब एक पेशेंट में बहुत सारे प्रॉब्लम्स हों. सो हमें उसमें एक कॉम्प्रिहेंसिव अप्रोच लेनी पड़ती है. अगर कोई पेशेंट आता है जिसको दांतों में कैविटी भी है, जिसके दांत ठीक से पोजीशन्ड नहीं है, न कलर ठीक है, न शेप साइज सही है, गैप्स भी हैं, अगर ये मल्टीपल इश्यूज़ के साथ पेशेंट्स आते हैं तो एक कॉम्प्रिहेंसिव ट्रीटमेंट प्लान पहले बनाना पड़ता है. स्टेप बाय स्टेप अप्रोच होती है. डिजिटल स्माइल डिज़ाइनिंग टूल्स भी यूज़ होते हैं इन केसेस में, एंड देन वी मेक अ ट्रीटमेंट प्लान एंड गो अहेड विद वट एवर इज़ एडवाइस. तो फर्स्ट एंड फॉरमोस्ट इज़ द हेल्थ ऑफ द गम्स that we really concentrate on. If you are not healthy, if you have a diseased teeth or gums, then we make sure that we remove that disease first, and then lastly then we go ahead with positioning the teeth with braces, maybe in a proper position, and then we go ahead with replacing the missing tooth with implants, for example, and last is the aesthetics that comes into play. Okay. Then we beautify the smile. So function is more important, health is more important, and then the smile comes in. So these are complex cases where we need a special team of dentists in our clinic, which are specialized in their own various fields, and hence we create those network of shared skills and perform treatment on the patient, which helps them also to give a quality treatment and a best treatment for our patients. Yeah.
Okay, that's great. So आपके क्लिनिक में किस तरह की डेंटल ट्रीटमेंट्स दी जाती हैं? You all specialize in, I think, various aspects of dentistry. तो उसके बारे में बताइए.
So Trudentz is a multi-speciality clinic where all kinds of dental treatments are done under one roof. We have a team of specialists. For example, we have orthodontist that performs on malpositioned teeth. They make the teeth straighter. We have a pediatric dentist that takes care of the child's teeth.
Okay.
And we have an endodontist in our panel that takes care of the painful teeth by doing root canal treatments on them. Then we have aesthetic dentist for correcting the smile and appearance of the patient. We have an implantologist that replaces the missing teeth with implants.
Okay.
And we have a periodontist that takes care of the gum part. We have an oral and maxillofacial surgeon that performs surgeries on the patient, wisdom tooth removals, and other surgical procedures like sinus lift and all, if you want to go ahead with implant placement. So these are various network, and we have associate dentists as well who take care of the hygiene of the patient and cleaning and bleaching procedures. So it's a team of specialists, and our staff is also well trained for all these procedures.
Everything under one roof. That's
Yes.
great. Acha, since you said bleaching, so I think bleaching is
Yeah.
also part of teeth whitening.
Correct.
तो क्या ये अच्छा होता है दांतों के लिए?
So yes, so bleaching is again a part of cosmetic dentistry procedure. Bleaching से दांत का जो कलर है वो लाइट हो जाता है and in turn it brightens the smile of a patient. So for me, I ensure कि पहले gum health, dental health proper हो, then only I advise bleaching to the patient.
Okay.
Okay, so फर्स्ट द स्केलिंग प्रोसीजर, रूटीन क्लीनिंग होने के बाद जब गम हेल्थ इम्प्रूव हो जाता है देन वी स्केड्यूल द पेशेंट फॉर द ब्लीचिंग प्रोसीजर. अब ब्लीचिंग आप क्लिनिक में भी कर सकते हैं और ब्लीचिंग एट होम भी होती है. जो पेशेंट्स को हम ट्रेस देते हैं वो घर पे ले जाते हैं, वाइटनिंग जेल्स खुद लगा के कर सकते हैं. सो जब हम लोग क्लिनिक में ब्लीचिंग करते हैं तो उसका एक प्रोसेस ऐसा है कि वाइटनिंग जेल होता है वो हम अप्लाई करते हैं टूथ पे आफ्टर प्रोटेक्टिंग द गम्स. वो गम्स में बैरियर लगाया, वो वाइटनिंग जेल लगाने के बाद देन उसमें लाइट से वो एक्टिवेट होता है जेल. बेसिकली दीज जेल्स आर नथिंग बट मेड अप ऑफ हाइड्रोजन पेरोक्साइड, कार्बोमेट पेरोक्साइड विच इज़ इन डिफरेंट कॉन्सेंट्रेशन. फॉर अ स्टिपुलेटेड टाइम पीरियड वी अप्लाई द जेल एंड वेट एंड अगेन रिमूव एंड अप्लाई मल्टीपल applications of it till we get the desired color. Okay, so this is how bleaching works in the dental office. Now there are some contraindications also where we advise the patient not to get their teeth bleached, and one of them is when a patient already has a thin enamel. That is the topmost covering. If your enamel is thin, then bleaching will give you more side effects. You know, so and it won't improve the color of your for which you came for improving the color. It won't improve it. So we have to be very mindful of selecting the cases for bleaching. And a person having a damaged enamel or a defective enamel is not a good candidate for bleaching. So selecting case for bleaching is also very important, and that. We also give you trays, bleaching trays to take away for home, but there we give very low concentrations so that it doesn't harm the gum. Okay, so that's how a bleaching works. Yeah.
So it's not really harmful उसमें concentration अगर
Yeah, if you select a good candidate for bleaching, that your dentist will only decide.
Okay.
So better the patient should not decide whether they have to go for the bleaching. They can just request the dentist that this is their desire, but the dentist has the final say to it and look at the enamel and everything and then decide whether you are a good candidate or no for bleaching.
ये बताइए डेंटिस्ट्री ट्रीटमेंट इतनी एक्सपेंसिव क्यों होती है?
So yeah, good question. Dental treatment expensive नहीं, neglect expensive होता है.
अच्छा.
So if you say, if I want to give a quality treatment to my patient, so what all things and factors determine it? So a clinic has to be well equipped. It has to follow strict sterilization protocols.
Okay.
Then a clinic has to have advanced equipments and materials and using high-tech technology. And then the dentist or the specialist should be highly skilled.
Correct.
And has to keep oneself updated with the latest technologies. Okay, then therein comes the overhead cost, the staff and all. And then the lab is also involved.
Correct.
So if you accumulate everything together, there comes a cost. So if you want to give a quality treatment to the patient, it will be expensive. So if your dentist is charging, be very happy because he's giving you a good treatment.
Okay. So tell me, which are good food and which are bad food for your teeth?
Okay, so let me start with the good foods first.
Okay.
So good foods are dairy products like milk, yogurt and cheese because they have calcium, phosphates in it, and calcium strengthens your enamel again, and phosphates, they help in remineralization of enamel, so they are good to consume for the health of your enamel. Then we have green leafy vegetables because they contain folic acid, vitamins and minerals which are good for your bone health also. Then we have fruits and vegetables. I can also add, green tea is also very good for your health because it has antioxidants, and so it helps in reducing the plaque buildup, so around your gum line. And so let's come to the bad foods. Bad foods may So number one culprit is sugary food stuff.
Okay.
So sugar food stuff, which is sticky also. So when it sticks to the tooth, bacteria are very happy. They start multiplying when they see the food is there for a longer period of time, and then they produce more acid, and the more harm it causes.
Okay.
So yes, number one top list is sticky, sugary food, starchy food like chips, pasta, and all. They are not good for teeth.
Okay. Even pasta.
Yeah.
Okay.
So it has starch in it, and very a lot of acid production happens. And then acidic foods, because they cause enamel erosion, like carbonated drinks and all, they come under acidic foods.
Acha.
So anything unhealthy you can think of is really not good for the teeth, because what I believe is, don't eat foods that stick to your teeth. If they stick to the teeth, then there's a happy time for bacteria.
Yeah.
That's why we prefer more crunchy and fibrous foods in our diet, because they are mechanically scrubbers. They scrub and remove the plaque which is accumulated on the teeth surface. So if the plaque is removed, then your teeth are as it is clean. So have foods that can naturally remove the plaque. Yeah.
So tell me, what excites you the most about this profession of dentistry?
So let me tell you a story. There was a patient of mine, a young man, maybe late 20s, and he came to my clinic and he was hesitating even talking to me.
Okay.
He just sat on the chair, and then when I saw the front two teeth were completely severely discolored.
Okay.
The color was changed. So I could see that lack of confidence in that patient. And you know what he told me? मैम मेरी शादी नहीं हो रही है बिकॉज मेरे सामने के दो दांत का कलर ठीक नहीं है, तो कोई भी लड़की मुझे पसंद नहीं करती है.
Correct.
And that was a very emotional moment, that time. And I said, don't worry, we will work on it. And then again, we followed all our protocols and performed and executed the treatment. And once the treatment was over, that patient, we were like God to that patient, and within a year he got married.
Oh, wow.
So these are the experience that we live for. These are the life-changing experiences that we bring to our patients' lives. So I think that moment, where there are a lot of emotions, and when there is true happiness that reflects from a patient's smile, where we can build their confidence, the overall journey, or the overall guidance, and the execution, and then the result.
Yeah.
So it's beautiful.
Amazing.
I can't put into words.
Yeah.
Most beautiful experience won't be put into words.
So tell me, how many times in a year one should visit the dentist?
Yeah, so it's very straightforward. Twice you should visit your dentist for a dental checkup.
Okay.
And what happens is, even if you do not have any problems in your teeth, still visit a dentist, because it ensures that आपके दांतों में कोई hidden भी cavity हुआ या ऐसी कोई problem जो आप नहीं अभी समझ पा रहे हैं, वो आपका डेंटिस्ट आपको बता पाएगा. और बिफोर इट टर्न्स इनटू अ प्रॉब्लम वेयर अ ट्रीटमेंट इज़ रिक्वायर्ड, हम प्रिवेंटिव मेजर्स लेकर के वो प्रॉब्लम वहीं रोक सकते हैं. सो ट्वाइस विजिट टू अ डेंटिस्ट is essential. Yeah.
Okay, tell me, how should an aspiring dentist learn dentistry?
Yeah, so if somebody is aspiring to become a dentist, he needs to choose science as integral subjects, physics, chemistry, and biology, and then start preparing for the NEET exam from the high school onwards. And then there is an entrance. Once he cracks the entrance exam of NEET in India, then he will have the options to choose various colleges that are available, depending on what study he has done regarding the colleges or what ranking that a person holds. Then you can choose the college and then complete your graduation in BDS, which is for 5 years in a particular college. And after that, if you want to pursue your postgraduate degree, then again there is a preparation, and you have to perform in the entrance exam. And then there's 3 years ahead for specialization more in dentistry.
Oh, wow.
Yeah.
अच्छा, ये बताइए कि is it better to work in hospitals or clinics to learn dentistry when you are very young?
So it's a personal choice first of all. Okay, and also depend कि आपके career goals क्या हैं.
अच्छा.
So अगर आप एक hospital में काम करते हैं तो वहाँ पे आपके साथ और भी अदर हेल्थ केयर प्रोफेशनल्स अवेलेबल होंगे. प्लस वहाँ पे आपका फिक्स टाइमिंग, सैलरी एक फिक्स्ड होगी आपकी, और प्लस यू विल गेट टू सी इन अ हॉस्पिटल मोर ऑफ ट्रॉमा केसेस and where you need to have the emergency, exactly the setups and all are there. So also there will be other professionals who will be helping you out in carrying complex dental treatments which cannot be done in a dental private clinic. So where admission of a patient is required, या फिर ऐसे cases जो already medically बहुत compromised हैं, जो dental private clinics में treatment नहीं करा सकते हैं. So yes, definitely you get to learn a lot in a hospital, and you will have a fixed salary, and but the only thing is you will not have the autonomy to have the decision over the treatment. आपके साथ और भी लोग होंगे जहाँ पे decision लेंगे treatment बनाने का. अपार्ट फ्रॉम दैट, अगर हम प्राइवेट क्लिनिक की बात करते हैं तो जनरली पीपल चूज और स्पेशलिस्ट चूज टू हैव बी अ कंसल्टेंट इन अ already established private practice. So when they come out after their graduation or post graduation, they will be attached to a established clinic already. They will learn the skills and learn from a respected senior dentist, and then maybe after a few years of experience they will move and start their own dental setup. So having an own dental setup will give you an autonomy. You decide the treatment for the patient, and you create an environment for the patient. You will give the experience to the patient of the treatment. And of course initially the income is not fixed, but I must say that after a few years when you have good patients, आपका income source का it can range to, it can go to really high. So yes, so that's the difference between it's very financially rewarding, a clinic it can be after a few years. So it's a personal choice again, I say, and what kind of career goals you have for yourself. With respect to your experience in dentistry, you can choose whatever you want to choose.
Okay. So let's talk a little bit about mouth ulcers and oral cancer.
Yeah, so mouth ulcers, basically they are nothing but they are very round kind of ulcerations, or round with a very red edges in the mouth, and they look like white or yellow in color in the center. They are very painful, I must say, and generally they get resolved in 1 or 2 weeks. Okay. And commonly these ulcers happen because of stress, because of any nutritional deficiency, or even when patient has injured himself with the brushing, traumatic brushing. Yeah, so there are causes for ulceration, and if it doesn't resolve within 1-2 weeks time, then we should get it evaluated with the dentist, because these untreated and uncured ulcers can convert to oral cancer in future. So if I talk about oral cancer, they do happen to patients who are chronic tobacco chewers, who consume alcohol, maybe medically compromised, immunocompromised patients, having HIV. So these are all the reasons, oral cancer can form. They are basically lumps in the mouth, and they can also manifest as an ulcer which is not treated, So for that, a thorough evaluation is done, biopsy is done, and then the patient is referred to respected cancer hospitals and all. Yeah.
Okay. Yeah. You are also a yoga enthusiast and a music lover. Tell us something about that.
So yes, apart from dentistry, my deep personal passions are yoga and music.
Okay.
So yoga is the most transformative part of my life.
Okay.
And I started as a yoga enthusiast, but I evolved into a yoga teacher.
Oh, okay.
Yeah, sharing my wisdom and knowledge to my students. So I took my teacher's training in 2020. And post that I started teaching. And teaching is a very beautiful experience, what my students give to me. What yoga has brought in my life is, that journey of growth and healing, and, getting answers, what your curious mind has. and instilling that peace within you.
Okay.
So you get a lot of energy and then you put it to your work. It's like that.
Correct.
So first you're so comfortable. It made me comfortable with myself.
Okay.
Okay, it made my mind very comfortable. So even if I sit alone, I'm not bored. I'm very
correct.
comfortable with myself, and that yoga has taught me to
Yes.
embrace myself and everything completely.
True.
So yeah, deeply adore yoga because that's a real thing in my life.
Same with me. I love doing yoga as well.
Yeah. So and music, yes, music is my passion since childhood, and I've received many accolades for that. For the same, I've won many awards my school and college time for music. I was into vocals basically.
Okay.
And yeah, and today if you see, I'm in collaboration with a UK based company, and we have released various songs like ghazals and devotional songs. We've released on various music platforms.
That's great.
Yeah, still
Good to
continuing
know,
that.
like, yeah. So you're like a multifaceted personality, and you love to do various things, which is so great.
Yeah,
Very
I
good.
just to be in the moment, be present in whatever I do. And I think that has helped me. And, just being where you are, having a focused mind in whatever you are doing, it makes your life a meditative experience.
True.
Mind is not wandering. Whatever you're doing, your 100% energy is into that.
Correct.
So it's like the here and now concept.
Right.
So that helps in having multiple talents, and whatever you are doing, you are putting 100% into it.
Beautiful.
Yeah.
Okay. आपको कुछ अवार्ड्स भी मिले हैं, उनके बारे में कुछ बताइए.
Yeah, so recently, 2024 May, we were recognized as Aesthetic Practice of the Year, and we were highly commended for Digital Dental Practice of the Year by FAMDent Excellence Dentistry Awards.
अच्छा.
And in the past also, starting from 2016, our clinic has won award for Clinic of the Year, Clinic Interiors of the Year.
Okay.
I think that was in 2018. And then we also won in our clinic one award for the Dental Innovation and Research because of the DTS Pro software.
Okay.
And Aesthetic Practice of the Year again, we were nominated. And yes, the journey continues. We are looking forward to more.
That's great. Thank you for coming here, Dr. Diya. It was a great experience chatting with you about the dentistry, and thanks for sharing all your knowledge with us and coming on my pod talk. Thank you very much.
Most welcome. Thank you.
So दोस्तों, ये था हमारा कॉन्वर्जेशन एस्थेटिक डेंटिस्ट डॉक्टर दिया रोहिडा के साथ. आपको ये कॉन्वर्जेशन कैसा लगा हमें ज़रूर लिखकर भेजिए, और आपके अगर डेंटिस्ट या डेंटल प्रॉब्लम से रिलेटेड कुछ क्वेश्चंस हैं तो हमें कमेंट कीजिए. एंड प्लीज़ डू नॉट फॉरगेट टू लाइक, शेयर एंड सब्सक्राइब टू पॉड टॉक विद एकता. थैंक यू.